Hey everyone, welcome back. Today we're talking about something that affects over 280 million people worldwide, yet most people still don't fully understand it. I'm talking about depression. And here's the thing, when you go to a doctor, you usually get a prescription and maybe a 5-minute conversation. But there's so much more happening in your brain and body that they don't always explain. So let's dive into what doctors often leave out. First, let's talk about what depression actually is. Most people think depression is just sadness, right? You're sad, you feel down, you stay in bed. But that's actually not accurate. Depression is a complex neurobiological condition that affects your entire system. It's not a character flaw. It's not something you can just think positive about. It's a legitimate medical condition, just like diabetes or heart disease. But here's what doctors sometimes skip over: depression isn't one thing. It's a spectrum of symptom that can manifest completely differently from person to person. Some people with depression feel numb and empty. Others feel intense sadness. Some become irritable and angry. Some experience physical pain with no clear medical cause. Some have racing thoughts at night but can't get out of bed in the morning. The stereotype of depression is someone sitting alone, crying in the dark. But someone might have severe depression while laughing at a joke. This is important because a lot of people don't think they have depression because they don't match that narrative. Now, let's talk about what's actually happening in your brain. Your brain communicates through chemicals called neurotransmitters. The three main ones relevant to depression are serotonin, dopamine, and norepinephrine. When these are imbalanced, it affects everything. Most antidepressants work by increasing serotonin availability in your brain. But here's what they don't always tell you. No one actually knows the exact mechanism of how depression works. You've probably heard the chemical imbalance explanation. Your doctor might have said something like your serotonin is low and this medication will fix it. But the truth is way more complicated. The chemical imbalance theory is oversimplified. Yes, neurotransmitters are involved, but we don't have a test that shows low serotonin. We can't measure your serotonin levels. Doctors don't do a blood test that says your serotonin is at 45%. It's not that simple. What we do know is that certain medications that affect serotonin seem to help some people, but we're still not entirely sure why. Depression is likely a combination of neurochemical factors: genetic predisposition, life experiences, trauma, stress, inflammation in the brain, and environmental factors all working together. Here's another thing doctors don't always discuss: inflammation. Recent research shows that depression is often linked to chronic inflammation in the brain. Your immune system might be in overdrive, producing inflammatory cytokines that affect your mood, energy, and cognitive function. This is revolutionary because it means some people with depression might actually benefit more from addressing inflammation through diet, exercise, and stress reduction than from medication alone. But how many doctors talk to you about reducing inflammatory foods or getting movement? Let's talk about the gut-brain connection because this blows most people's minds. Your gut produces about 90% of your serotonin. Your gut bacteria, your microbiome, directly influences your mood, anxiety levels, and mental health. If your gut health is compromised, your mental health often follows. You could be eating a terrible diet, have dysbiosis in your gut, which is throwing off your neurotransmitter production, and your doctor prescribes an SSRI without ever asking about your digestive health. These things are connected. Now let's discuss something really important that often gets missed: the role of stress and trauma. Depression doesn't always come out of nowhere. Often it develops in response to chronic stress, unresolved trauma, difficult life circumstances, or significant losses. Your brain is doing what it's designed to do: it's protecting you by shutting down. It's conserving energy. In evolutionary terms, this makes sense. When you're in danger or under extreme stress, your brain might shift into a state of reduced activity and motivation as a survival mechanism. But modern life keeps us in a constant state of low-level threat perception, and many doctors treat depression purely as a chemical problem, without addressing the root cause of why your brain might have shifted into this state. Here's something else that's crucial: trauma and depression are deeply connected, and most people with depression have experienced some form of trauma or chronic stress. It might be childhood trauma, recent loss, ongoing abuse, discrimination, or repeated failures. Your brain learned to respond to these threats by shutting down. And sometimes, even when the stressor goes away, your brain stays in that pattern. This is why therapy is so important. But many people are prescribed medication and never offered therapy, or they're offered a limited number of sessions. Let's talk about the role of exercise, because this is massive and criminally underdiscussed. Exercise is one of the most effective treatments for depression. We're talking about effectiveness comparable to medication in many studies. But how many doctors sit down and say, "Here's a structured exercise program I want you to follow"? Usually what happens is the depression makes it hard to exercise. So you're in this awful catch-22. You're depressed, so you don't have energy to exercise, but exercise would help your depression. The barrier is real, and doctors often don't help you navigate it. Sleep is another huge factor. Depression often involves sleep disruption, either insomnia or excessive sleeping, and these sleep problems actually worsen depression. It's another cycle. You're depressed, you can't sleep, or you sleep too much, which deepens the depression, which makes sleep worse. Many people are never given specific sleep hygiene protocols or help addressing underlying sleep issues before being medicated. And then they get on medication that might further disrupt sleep, and nobody's managing the whole picture. Let's talk about medication itself, because doctors don't always fully explain this. When you take an antidepressant, it doesn't usually work immediately. Most take 2 to 4 weeks to start working, and sometimes longer. And here's the thing, antidepressants work for maybe 60 to 70% of people. That sounds good until you realize a third of people don't respond to medication. Some people try 5 or 6 different medications before finding one that works. Some never find one that works at all. And then what? Are they just told they're treatment resistant? Many doctors don't discuss alternative approaches. Also, antidepressants are often presented as something you'll need long-term, possibly forever. But there's growing research showing that combining medication with therapy and lifestyle changes might allow people to eventually come off medication. Some people can, some can't. But the conversation often isn't had. You get the prescription, and that becomes your solution. Let's discuss the social and relational aspects of depression. Humans are fundamentally social creatures. Loneliness and social isolation are major risk factors for depression. Meaningful relationships are protective, but depression thrives in isolation. You feel bad, so you withdraw. You withdraw, you feel worse. This is a trap that needs active intervention. You might need help reconnecting with people or building new relationships. Many doctors don't address this. They don't ask about your social support system or help you develop one. Here's something else. Depression looks different across cultures and demographics, and there are major health disparities in how depression is diagnosed and treated. Marginalized communities, people of color, LGBTQ+ individuals, and others often have their depression overlooked or misdiagnosed. They might not receive the same quality of care. This is a reality that's often invisible in individual doctors' offices, but it's real and it matters. Let's talk about what depression actually feels like, because it varies so much. For some people, it's a physical heaviness. Your body feels like it weighs 1,000 pounds. Moving takes enormous effort. Thinking is slow and difficult. For others, it's emptiness. Nothing feels good. Food tastes bland. Things you used to love feel pointless. Some experience intense shame and worthlessness. Some feel invisible and forgotten. Some have racing thoughts of failure. Some feel nothing at all, just numb. The diversity of the experience means a one-size-fits-all approach won't work. And here's the hard truth: depression can be life-threatening. Suicidal ideation is a symptom of depression. Doctors should be screening for this, but they often don't, especially if you're hiding your depression well. If you're in crisis, You need to know that help is available. Please reach out. Now, what should you do with all this information? First, understand that your depression is real and valid. Second, if you're working with a doctor, push for a comprehensive approach. Don't accept a prescription alone without discussing therapy, lifestyle changes, sleep, exercise, diet, and relationships. Third, find a therapist if you can, even alongside medication. Different types of therapy work for different people. CBT, psychodynamic therapy, trauma-focused therapy, ACT. And fourth, be patient with yourself. Recovery isn't linear. Some days are better than others. Healing takes time. Depression Explained is ultimately about understanding that it's not one thing. It's not just brain chemistry. It's not just circumstance. It's not just trauma. It's usually a combination of biological, psychological, and social factors all interacting. Your doctor might give you a pill, but healing depression often requires a much broader approach that addresses your whole self, your brain chemistry, yes, but also your body, your relationships, your environment, and your life meaning. If this resonated with you, please like and subscribe. If you're struggling, know that you're not alone and help is available. Thanks for watching.